my name is Elise van Mulligen. I'm a researcher and epidemiologist from the Netherlands, and I'm at Liphardt 2026 today at London. And next to me is standing Dr. Anna-Maria Liphardt. She's from Erlangen, Germany. And we're going to talk about your presentation. And the title of your presentation is really nice, I must say. I was impressed. And the title is cartilage made for space, or do we need to keep our feet on the ground? Can you maybe tell us a little bit more about your main message?
As you say, part of my research happens in space. So I do investigate immobilization effects on articular cartilage or joint health, but articular cartilage is part of it. And space allows us to really look at the effect of only immobilization. So we don't have the combination of injury, disease, certain side effects of drugs, but we can purely look at the harm of immobilization, and that's what I'll be talking about. So if we put healthy people to bed or in space, what will cartilage biomarkers and cartilage look like when they come back?
Oh, that's really interesting. Can you say something about how long does it take when this effect takes place? Like, how long does it take and why would a rheumatologist care about this?
So it depends on which method you use. And the imaging methods, of course, or also pain, would respond very late. So cartilage, you don't feel when it's gone, and it takes weeks and months if we actually see it in imaging. But when we use biomarker techniques, like biomarkers in urine or blood that show us the degradation or formation of cartilage constituents, we can see it as early as 24 hours. So you can directly see that certain markers decrease or increase. So the tissue does respond very quickly.
Oh, yeah.
It will not affect function right away, but it will accumulate to effects that then result in diminished function.
No, that's rather quick indeed.
Yeah.
So maybe can we learn some more from microgravity research or space and how we can translate this to like cartilage and bone on the earth?
Yeah, I think very much so because I like it. But oftentimes the spaceflight research is done in very standardized environments. So these bed rest studies are very controlled, and we can use it to look at isolated effects, as I said. So when in disease, we have all this mixture of the patient is in pain, the inflammation destroys the bone, and the person doesn't move because of pain and destruction. It's really difficult to find out what contributes how, but when we understand what the harm of just immobilizing people is, then we can add that into the game, so to say, and hopefully help the patients with encouraging them to move when they feel like moving, and with that also to prevent additional loss of structure because they don't move enough and they don't expose themselves to enough mechanical loading.
Yeah, I understand. Maybe another question. I think that within rheumatology, we're really focused on the inflammation, try to solve the inflammation. But do you think that like the mechanical part is a little bit underestimated now?
I would think so. And especially nowadays treatments are so good and a lot of patients achieve remission or low disease activity, so they are able to move. And then I think we underestimate how much prevention or even how much we can secure our skeleton by being active. And yes, I do think that's underestimated, because once the drug works, we usually don't continue and look at all the other factors that also affect musculoskeletal health.
Thank you. Thanks a lot.
You're very welcome.
Thank you for the nice discussion. Yeah, thank you. It was a pleasure. Also, thank you for watching, and I wish you a really nice rest of the Congress.